to get in and get settled. All right, we'll go ahead and get started. Good evening and welcome to tonight's panel discussion of the documentary Jacinta. I'm Heather Drake, the membership manager of the Maine Public Health Association. MPHA is co-hosting tonight's panel with the Maine Substance Use Prevention Services administered by the University of New England with funding from the Maine Center for Disease Control and Prevention, the AdCare Educational Institute of Maine, and the Maine Osteopathic Association. We are so thankful for the participation of our panelists, who we will introduce momentarily, as well as Jacinta Hunt and film director Jessica Earnshaw. Thank you to Jacinta, Jessica, and their team for bringing the story to light. And thank you as well to everyone in attendance this evening. Before we begin, just a few housekeeping items. Tonight's panel is being recorded and will be available on MPHA's website at www.mainepublichealth.org and emailed to registrants as well. We are using a webinar format tonight, so videos have been turned off and you are muted. If you have a question for the panel, please use the Q&A function and indicate which panelist your question is directed to, and we'll do our best to answer as many questions as we can. So we'll go ahead and introduce tonight's moderator, Liz Blackwell-Moore, who's the public health manager for Cumberland County. She'll introduce the rest of our panelists and facilitate tonight's discussion. So thank you, Liz.
Great, thanks. Thank you, Heather. Thank you all for being here today. My name is, as Heather said, is Liz Blackwell-Moore. I use she, her pronouns. I am the new public health manager for a new Cumberland County Public Health Department. And prior to this role, I worked as a consultant and in prevention, primarily focusing on supporting communities and organizations to take a restorative and trauma responsive approach to solving complex public health problems like substance use disorder, mental illness, and toxic stress. And I am very much honored to be here today to be moderating this conversation. Jessica invited me to view the film a few years ago and be a part of a discussion with folks from the Maine Department of Safety and a few other community folks. And I was immediately struck by Jacinta's bravery and generosity for letting us, into her life, and for Jessica's ability really to capture the complexity as well as the humanity of substance use disorder and the impact of generational incarceration and trauma. The film does all that while yet also bringing a sense of hope and highlighting this power of love. And we have an amazing group of panelists today, and I'm excited for all of us to be able to hear their thoughts on the themes of the film and to really hear more about what they're working on to address the problems that the film highlights. So today we'll start with having each panelist introduce themselves, and I will then ask the panelists some questions I've prepared, and then we'll pull some questions from the audience. And I welcome you to post your questions, as Heather said, in the Q&A. And I'd love to, in the spirit of the film, I really would love to invite you to ask questions from a place of generosity and a place of non-judgmental curiosity and of collective problem solving. So with that, we can start the introductions. So I'd love, Jessica, if you would start, if you would be willing to introduce yourself and give us a quick overview of your work or goals as they relate to the themes of the documentary, and in your case, to the documentary itself.
Hi, so yeah, I'm the director producer of Jacinta. My name is Jessica Earnshaw. I have a background in photojournalism and documentary photography. I was working on a project on aging in prison, which I was photographing at the prison that Rosemary and Jacinta were incarcerated at. And yeah, I think my goals when I started the project were, I was just really struck by Jacinta and her mother Rosemary and their relationship. And I was already interested in generational trauma and just generational learning. And I wanted to understand, how did Jacinta end up following in her mother's footsteps? And that was really the question that took me throughout the filming. and just trying to better understand that. But I think goal-wise, like with the film, I've hoped that people would have more empathy for people like Jacinta. You know, Jacinta's story is not unique in a lot of ways because there are so many women that go through this. And then on top of it, what's been interesting since the film has come out is that people have been reaching out to both Jacinta and I with, I think with more empathy, but at the same time, it's been interesting because I think people have, in a way, looked at their own trauma, and it's been almost cathartic, I think, because we're getting a lot of stories from people just being like, I went through this, I'm Jacinta, or I'm Rosemary, I'm Kaylin. So that's been really amazing. And so I think it went beyond my goals for the project.
That's lovely. Wonderful.
Yeah.
Great. Well, thank you for introducing yourself. Jacinta, I wonder if you would be willing to introduce yourself and just, just give a quick little overview of your work and goals as really relate to the documentary.
Sure. I'm Jacinta Hunt. I am the subject of the documentary Jacinta. And basically the work I'm working on right now is family work when it comes to incarceration. My focus is the youth. And basically I just try to meet as many people as I can and network and try to, fill the gap for the youth and hope that we can stop them from going into the adult system, or we can teach them the life skills that their parents aren't able to pass on to them. And that's really my goal. I hope to someday have my own nonprofit and be loving a whole bunch of little kids back to health.
Wonderful. Thank you. Great. Nick, I wonder if you would introduce yourself, please.
Sure. Hi, everybody. My name is Nick Beveridge. I work at the University of New England at the Center for Excellence in Public Health, and we have a grant through the Maine CDC's Maine Prevention Services to provide training and technical assistance across 19 subrecipients in the state of Maine to do primary prevention. So that's the upstream kind of stuff to get people early as possible. And we are currently in an extension year, so this is our 5th year of that grant.
Great. Wonderful. And how about Meredith?
Hi there. I'm really happy to be here and delighted to be a part of this. I am Dr. Meredith Norris. I am the past president of the Maine Osteopathic Association, which is part of my involvement in this, but I'm primarily here because I am somebody who's been working with substance use disorder treatment in Maine for over 15 years. And I have been hopefully following in the footsteps of my many of our friend Jesse Harvey, continuing to make beautiful trouble. In my case, it's helpful. I work at a variety of treatment environments, including a methadone clinic in IOP in Augusta and Sanford. I have an office where I treat substance use disorder and other things. And as far as intergenerational stuff goes, my grandmother once wrote a letter of complaint to the Pope. And so I like to feel that I'm walking in her footsteps too. I have often said that I consider my greatest responsibility to weaponize the privilege I have, because nobody notices a middle-aged lady coming.
Wonderful. Thank you so much. And Mallory, if you could introduce yourself, that'd be great.
Sure. Thank you. My name is Mallory Shaughnessy, and there we go. Mallory Shaughnessy, and I'm the executive director of the Alliance for Addiction and Mental Health Services in Maine, which is a statewide association of the providers of substance use and mental health services, mostly in what we call the safety net for folks on Medicaid, or what we call Maine Care, and uninsured. So we have members across the state, and I advocate at the legislature and educate around these issues and try to get investments into the system of care. And on a note of, nobody sees a middle-aged woman coming, I like to use that as well. I can sneak into all kinds of meetings and make statements that other people will not. And I like to do that. But I also come to this with a lot of passion for this work, having family history and of substance use and some overdose deaths. And so it's very meaningful to me. I'm glad to be here.
Wonderful. Well, thank you all for being here. I would love to start with a question for you, Jacinta. At the end of the documentary, I really was left with this deep sense of hope. But also really with the knowledge that recovery from substance use disorder and revolving trauma, it takes time, the right supports, a trauma-informed, family-centered systems. I know people in the audience will be interested to know more about the work you're doing today and to hear about your work advocating for, healing-centered systems, particularly the criminal justice system. And you're calling in from DC right now. I was wondering if you could tell us a little bit more about the work you're doing and your reason for being in DC.
Yeah. So I am, yes, currently in DC, and I came here to pretty much convene with Dream Corps, who's doing a lot of amazing bills around incarceration and reform, but also more importantly to celebrate the First Step Act. Is that how it's said? First Step Act or bill?
Oh yeah, the First Step Act. Yeah.
Yeah, which I didn't have like a wealth of information about, and just since learning, it actually is an incredible bill, and it does give people, just aside from like making mistakes and the system being what is an addiction and everything else that goes into traumatic situations, to not give somebody who makes a mistake the chance to redeem themselves after already serving time and being away from their family. And we pay so many moral consequences that to just intensify or amplify our incarceration, like we're not going to get the point that we made a mistake, is just crazy. So the fact that like there's a lot of people out there getting that chance and they're coming out and doing powerful things is really what keeps me going every day. I just made the statement today, like, who thought that a room full of felons would be the strongest room to be in DC today? Like I felt so empowered, and looking around, I'm like, you would have never known that we were all incarcerated or addicted or whatever it was. So I am here joining a very incredible, strong team. I'm learning a lot, and I'm hoping to like recruit as many people as I can, and just really build some awareness on reform and addiction and trauma, because trauma is a huge part of it. And yeah, that's it.
Great, wonderful. Thank you so much. Jessica, I'm wondering, you and Jacinta have known each other for many years now, and you've now been working together to advocate, for dignity for incarcerated women. And I'm wondering if you can tell us a little bit more about like kind of what you've learned from working with Jacinta and working on this project.
Yes. I learned so much from Jacinta. I think I would say that following Jacinta into her addiction was when I just feel like I learned like way more than I think I could have ever possibly learned. I think I just saw firsthand how hard and it was for her to come out of it. I felt like there was not a choice anymore at a certain point, I felt that, when Jacinta got arrested and went back to prison, after that initial detox, where we started talking again in the jail, I felt like I saw her again. It's almost like when someone is that far into addiction, I feel like you really lose, I don't know if it's not like your soul, but it is something that is like tangible, because I felt like when I saw her again sober after such a long period of time, I was like, oh yeah, there you are. Like I hadn't seen her for a while, So I feel like I'm just so grateful for Jacinta for trusting me, because, I think a lot of people would have told me to go away, or, I think, or just been too ashamed. There's so much shame around addiction and just not wanting to be followed everywhere. And Jacinta, never told me to turn the camera off, like was totally in. And, but yeah, I feel like I learned a lot about addiction, but I also learned a lot about how hard it is for people when they come out. There's definitely like a divide between, prison, and then you come out into the community, and then how do you get onto your feet? And that first month is so so you're so vulnerable. And I just felt like, you know, when I first met Jacinta in the prison and all these women who had very similar stories of trauma, I was like, this is the wrong place for them. You know, it just seemed so backwards to be incarcerating people who they need healing and help and love and support. But then on the outside, I hate to say this, but I was praying she'd go back because there was like so little for her. And I just think there's something really messed up about, you can only get that if you're incarcerated, you know, like, so, I mean, I feel like it, you know, and I think the other thing too, is like, the thing that really kept me going filming this is just, you know, there's so much love in this family. And it's, you know, love, you can't save, you know, your family members with love alone, you know, you know, and there's so much of it. And I don't know, I could go on, but I learned a lot from her.
Thank you. Yeah, I appreciate your piece of the comment you make about how it's no longer, you know, it's no longer a choice. And I'm thinking, Meredith, I'm wondering, you know, substance use disorder is often wrongly thought of as a choice or a product of a person's kind of willpower. One of the things I found so extraordinary about the film and Jacinta's story is the way you really come to understand that individual choices are really such a product of family and friends and community and experiences. And, you know, you've been treating people with substance use disorders for a really long time. And I'm wondering if you could share with us what you see as some of those kind of key ingredients for developing a substance use disorder and the key ingredients for recovery and healing as well.
Well, I will tell you that I give the lecture to the medical school on substance use disorder. And I typically start off with telling the stories of some of the people I've known and then adding, would you do drugs? You know, because I would do drugs. I would do, you know, and the idea that we can other people and say, and many of the arguments that I have are actually with fellow healthcare providers and I've really gone into battle with like the nursing staff of an emergency department or, you know, the inpatient, because there's always this, well, I never did this, like it was as a result of your superior judgment and just that you didn't have this particular thing happen. And the ingredients are, you know, it's very inherited, and we don't go in and yell at everyone who has the same kind of type 2 diabetes that their parents had. Trauma is a big part of it. And I hammer on that when I've met with hospital administrators and stuff. I said, we need to stop thinking of people when they come into the hospital as though they're criminals and more like they're Katniss Everdeen who just got out of, you know, the Hunger Games, or Frodo who just got back from Mordor, that these are people who have been through the fire. And of course, they're not going to act like people who haven't. And when I have med students with me, I always ask them, what surprised you about this? Like, what did you think? And what have you found? And the first thing they always say is, I can't believe how much these people want me to be there and hear about them. Like that they really want doctors, they want other people to understand their situation. And also how much these are people who are doing something incredibly difficult. And I always say, you know, if you're getting over a heart attack, they'd be having a walkathon for you and bringing you baked goods. And we need to really reframe it that way, because I'm always impressed by people who choose to get sober after, because that's the really, really hard thing. That's an incredibly hard thing. It's taking the red pill, right? I don't know why I'm doing all this cinematic reference today, but it's something amazing and admirable and ought to be treated that way. And, you know, the odds really aren't in people's favor. It's a very, very difficult thing. And choice was never in it. And, you know, I'm sure most of us get into these conversations when staggering with strangers on Facebook. There's inevitably somebody, when somebody just puts out a, hey, there's bad stuff around, a lot of people are over, I was thinking, well, maybe they shouldn't choose to do this. I'm like, oh, okay, good. Thank God you showed up, dude, on Facebook, because it never occurred to the rest of us. So yeah, I don't know anybody who said, you know, I've made a really informed decision of 2 different paths and I've chosen this one because I completely understand what I'm doing right now. It's never that way. And it's just disgusting that people still talk about it that way.
I'm wondering if you could tell us, what then do you see as sort of the ingredients for that recovery and healing? Like when you see it working best, what do you see that people have in their lives or what's happening for them that really supports that?
You mean like what works?
Yeah.
The horse we flog is people, places, and things. In that people kind of understand how much you need to change your environment and your contacts and the people around you, but it usually takes a few tries to go, wow, this really means I need to get rid of all the phone numbers. Wow, this means I really probably can't even be in this neighborhood. A great disservice at the Just Say No campaign, for those of us who are old enough, is that it implied that it was realistic to be in a really high risk environment and just plan on saying no. And it'll be your fault if you used, because you didn't just say no. And people in recovery are very hard on themselves. They go, oh, you know, I was weak. And I'm going, you were in a place and somebody offered you something and it was right there. That wasn't weak, that was normal. Now we need to figure out how to get you not to be in that situation and recognize that situation. And a lot of the ingredients too have nothing to do with drugs. In fact, most of it has nothing to do with drugs. It's okay, now that you're not doing drugs, you're having really big emotions that are happening and you're noticing. I always say when people start using, they turn into a werewolf and then they have a little recovery and they're not a werewolf anymore. And now they're having to look at everything that happened while they were a werewolf. And a huge amount of it is simply, I have no idea how to have emotions. At the time when I might have been learning, I didn't have people around me who processed anger and fear and trauma. And I don't know how to do any of this. And I want to feel differently than I feel right now. And I already know one way that's going to make me feel different. So what are some others I could do? And do I have the resources? Like people forget there's not a great trauma therapist under every rock and tree in Maine that people have access to. But those are the ingredients. Are there resources for managing the big emotions that you have? Do you have the ability to leave an environment that's high risk? Do you have the medications that you need to normalize your brain if you have a condition that would do well with that? Do you know, all of this stuff? And instead, what do? We re-traumatize people. And we shame them and we criticize them. And that's the opposite of helpful. And so, yeah, those are, I mean, like most of us, I could go on and on and on, but
yeah, thank you. Well, I'm wondering, Mallory.
Can I make a quick comment?
Oh, please, Jacinta, go ahead.
I love everything that you said. I absolutely love everything you said. I just want to add to that for myself who has lived through and peoples and places and things, yes, that's very important. What helped me is boundaries, like knowing my own space is my own space. And that helped me eliminate needing to wonder where I am and who's going to be there in the situation I'm going to put in. Honesty, I was honest with only my recovery coach in the beginning. And then I just started trusting one more person. Honesty, education, not just an education, like higher education, educate yourself on addiction, what it's doing to your brain, how you're going to think, know before it comes, like be prepared for these things. And the final one is always have a peer in recovery, because when you don't have the answer, they will.
Excellent. Yeah, and it doesn't have to be 12-step. It just has to be know somebody who knows how to be sober and has done it for longer than you.
Well, I'm wondering, thank you both. That's wonderful. I'm wondering, Mallory, if, you know, we know children can be, you know, severely impacted by a parent's incarceration. I'm wondering in this conversation, like what are other ways to address addiction without incarceration? And specifically, you know, what are practice and policy changes that you think Maine needs in order to use the things that Meredith was just talking about, in order to be able to use those evidence-based practices? What do we need to stop using incarceration for people with a substance use disorder?
Well, this is a key question. And I think the basic answer is we have to stop criminalizing drug usage as we do. We treat addiction, treat it as a disease, and acknowledge that it does have a community component. It does have a familial and a generational component, as we're talking about a trauma-based coma. But beyond just the family and the intergenerational family, it is a community problem. What messages are in our community, what we hear, what we see, are all part of it, and what supports we provide for those that need support. So it is a community problem, and it is a physical disease, not a criminal activity. That's the bottom line. That has to become the norm. That has to be normalized. You know, there's the example that's been much touted of Portugal, where Portugal decriminalized all drugs. I think it was in 2000, and it became effective in 2001. And we talk a lot about just the decriminalization side of it. And it was for small amounts of that somebody had for usage. It didn't decriminalize, you know, big trafficking. It didn't decriminalize some of those, you know, any violent, you know, crimes or anything like that. But a person using drugs because they have an addiction, it decriminalized that. But beyond decriminalizing, I have a quote here I want to read from a study that was done on Portugal in 2020. And it says, most accounts of the Portugal experiment focused on decriminalization, but decriminalization was only part of a broader effort intended to encourage treatment. In turn, the country made financial investments in harm reduction and treatment services, and research in the United States shows that $1 spent on treatment saves more than $1 in crime reduction. So it is a win-win type of a situation. You know, that investment in treatment, having there be an alternative, something that somebody can go right to rather than be arrested, so, or go into jail. I think, who was it? Meredith, I said, you know, I think said, I hate to think this. No, it was Jessica. I almost wanted Jacinta to be back in jail where she was safe, where she was getting something, as opposed to being in the community where she was getting nothing to help her, really. And I think that's the key piece, is that we spent a lot of money in this country investing in the war on crime and criminalizing possession, criminalizing the use of a medication that had been a medication, but the use of this as for somebody who has addiction. We criminalized that, spent billions of years. We need to turn that and say the norm should be treatment, and we need to invest that money in expanding the access to treatment and the treatment for family supported treatment, where in Maine for years, there was one place in the state of Maine that a woman could take her children and get treatment for substance use disorder. One place in the entire state of Maine with limited beds where she could actually keep her children and have an actually an intergenerational treatment program. And there's you know, a few other options now, but we do not meet the need by any stretch of the imagination, as you saw, Jessica, when you were in the prison and seeing the folks there, the jails. You know, so, you know, turning away from the war on crime, turning into a investment in treatment. You know, as an undergrad, I did economics as one of my majors, and we talk about supply and demand and supply and demand. And the war on crime was a war on the supply. We try to eradicate the supply, but what economics teaches us is, as long as there is a demand, there will be a supply. And we have seen over the years, as one drug gets, you know, taken down, as one gets, you know, oh, it's crack, oh, it's this, oh, it's that, and they put in all this money to stop that drug coming here. Well, addiction is addiction, and addiction is there, and addiction is a disease, and it's intergenerational, and it's trauma-based, and it will go to another drug. And we don't talk that often about alcohol, which is just, you know, the main one that many people have an addiction to. Ubiquitous, exactly. But you know, we tried to attack it as a supply problem, and it's a demand problem. And we will never cut the demand. There will always be a supply until we cut the demand. And treatment, recovery-ready communities, investment in family supports, investment in you know, community treatment is what will cut the demand. We will never win until we do that.
Mhm.
I think that is, that is one of the, to me, the fundamental, piece
Yeah,
that we have
great.
to think about.
That's great. And I think that actually flows nicely into my question for Nick. Jacinta's story so clearly illustrates the impact that family environments and experiences have on a person's risk for developing a substance use disorder. That piece around, the demand issue that Mallory's talking about. I'm wondering, as communities become more aware that prevention isn't just about teaching kids the dangers of substance use, what prevention efforts do you think are having the most impact, and what additional prevention efforts do you hope will happen in the near future?
Sure, thanks. And I know we have a lot of our community partners are on the call today, so I'm gonna narrow it down to a couple. They do a very comprehensive mix of different strategies. But just knowing your question ahead of time, the couple that came to mind that are the most important, I think, are around availability and access for young people. So these are young people who have not started using substances yet. They're less likely to use if they don't have access to those substances. So Drug Take Back Day is a really important thing that a lot of our community partners sponsor across the state, so that there are not medications in the house that have expired that are just sitting in medicine cabinets, available to young people that are looking to possibly experiment. Another thing that we do is safe storage promotion of medications, but also alcohol and other substances that might be in the home as well. So family units are locking up their alcohol. Mallory mentioned alcohol is still the number one, addiction in the state, but also medications. And now that marijuana is legal in the state of Maine, locking up marijuana as well in the home so that young people don't have that same access to it.
Mm-hmm.
The other thing that I want to talk about is something called positive social norming, which a lot of our subrecipients do for info dissemination. We have the Maine Integrated Youth Health Survey here in Maine that gives statistics on usage for young people. And it's really easy to read that as 20% of youth are smoking marijuana. This is not the exact number. I don't remember what it was, but are smoking marijuana. So that feels like a lot. But when you read it, that 80% are not using marijuana, that I think is a more comforting feature for young people. It's something that, like, okay, I'm not alone in this if I'm not using. It's not that everybody is doing it. So we're trying to reframe the language around who is and isn't using a little bit.
Mm-hmm. Great. And anything,
if I could I,
sorry, please go ahead.
Yeah, could I tag on that to a little bit? I used to do work in prevention. I spent several years, I did work with you, Liz, and others that are on here. But work in prevention and looking at that environmental change, as you're talking about, in the social norms that we want to change for prevention for youth. Recovery ready communities sort of roll right through that and come out of that. When we talk about recovery ready communities, we're saying we should, what environment are we living in? Do we have to have a little bin of alcohol setting next to every counter at a Walgreens, or, sorry to say names, but a drugstore? It's that ease of access is a contributing factor within our communities for both prevention and recovery, and we need to be thinking of that too. It's on both sides of that continuum. They kind of wrap together. So I just really wanted to tie those two pieces.
Yeah, that's great. Thank you. I'm wondering, Jessica and Jacinta, I see that you've come together now. And there's a question from the audience here I would love to ask you, Jacinta. It's from Natasha Smith, and she says, I'm a case manager and would like to know if there's one or a few things that you feel are important to know and to do to help support recovery, and anything to avoid that isn't helpful for providers to do to support recovery, along with transitioning from prison back into the community.
Yeah. Oh, wow. That's a loaded question.
I know.
I feel like knowing that dealing with somebody in recovery or active addiction, any path that they're on, you have to know the situation. So like, if for me, when I first got out, it was really hard for me to keep in contact with all of my caseworkers and all of the different people, and to even remember, like, Brandon's my housing manager, Christine's my case manager. just know that in the beginning, like being proactive with them is what really gets the ball going, because they're not used to taking the initiative, and especially not for taking the initiative to better themselves.
Mhm.
So be, absorb your cases. And I would say the best way to support recovery is let them have their recovery. A lot of people want to press one way or another on somebody,
Mhm.
whether it be AA or MAT, abstinence, therapy, group therapy, and like, just know that, everything with recovery is individualized, and allow somebody to like absorb their own story in their life to know how they're going to move forward with that. And stay open-minded, know that not every journey is going to be the same. And that we're just looking for people to accept us and understand us in the beginning. So, do your job with an open heart.
Yeah, thank you. Yeah, and I feel like what in many ways is like having a person-centered approach, like approaching the person, and that brings me to this piece really around harm reduction. And I'm wondering if Meredith, if there are times during the film that I saw lots of opportunities where I was thinking, that someone, a person, organization could be engaging with Jacinta or any of her loved ones with harm reduction services. And I'm wondering if you could tell us a little bit more about the role that harm reduction plays in addressing addiction, and what more we could be doing to prevent overdose deaths.
As one of my colleagues, Tim Cheney, is fond of saying, dead people don't get sober. And for the big picture of harm reduction doesn't even need to apply to substance use. It's accepting wherever the person is and their current exposures and figuring out what's going to allow them to survive that. I mean, we could have that conversation about people's eating. We could have it about abortion. We could have it about a lot of things. What's strange about harm reduction is how many opinions come into it, when the reality is, as I said earlier when we were preparing, in medicine, we're only allowed to do expert opinion if there's no evidence. When there is evidence, we have to follow that. And the evidence on harm reduction programs is that they don't just save lives, because that's the obvious rallying cry, but they also reduce secondary consequences. When there's overdose prevention sites, which we got one in New York, we're working on in Maine someday. It's not just that people survive, because as long as we're othering people, we don't care about those who choose to use drugs, right? So they should use drugs if they don't want to. But we also see fewer crime in the area. We also see fewer secondary infection from people who use needles.
Mm-hmm.
And also, let's talk about the harm to the family members whose, maybe their provider or their parent or their loved one is suddenly going away or being incarcerated. There's a lot of damage and a lot of harm that can be mitigated if we are taking our lens that we're not trying to stop a particular behavior. And I don't like to call substance use a behavior, because it smacks of bad girl, but
Mm-hmm.
we're not trying to stop this particular thing. We're trying to mitigate irreversible consequences of that thing. And
Mm-hmm.
the evidence is really, really strong that this is a good idea. It's not a question. It's not a, hey kids, I wonder if this would work. There's other countries and other communities that have done it with great success. And I still remember sitting on the City Hall steps with Jesse Harvey at the die-in, and him saying, there is literally no good reason not to do this. It makes good economic sense. It makes good medical sense. It makes good moral sense. There is absolutely no reason to withhold harm reduction resources, other than people don't want to, because they feel like, why should those folks get to whatever it is?
Mm-hmm.
But yeah, as a physician, it's a slam dunk. And as to what could have been, I mean, I don't know if Narcan was available. It sounds like it sort of was. I was really happy in the documentary to see that in general, the emergency department people seem to be nice. admittedly, there was a camera going, but a big part of harm reduction is not re-traumatizing people when they come in to get medical assistance for their condition. You know, are you, I had a former student who was went on to do a surgical residency, and he encountered somebody who was using drugs, and he knew they were going to leave so they could use. And so he walked them through, it's been a few days since you used, don't forget your tolerance might be a little bit different because you've been in the hospital for a week. At no point did he say, now don't go out and do this, because that's not a useful conversation. But he did say, here's some things you can do. Make sure you're inside. Make sure that somebody's with you if someone can be with you. And, you know, as Mallory said, economically, it's such a better use of our energy and resources. You know, the moral outrage should be about the people who are getting in the way of harm reduction, not the people who are participating in it.
Well, I think that brings us to the conversation too, just about stigma and shame in general. And I wonder if anyone is and could speak to, you know, where you think we are right now with sort of tackling shame and stigma, and how prevalent it still is within, particularly within a treatment setting. And I'm curious if folks have thoughts about how we can continue to reduce shame and stigma, and what work we should be doing, and what work perhaps some of the audience members could be doing to be a part of that stigma reduction. And I'm just throwing that out to anyone in the panel that might want to answer that question.
I'd love to throw in a piece if I could.
Yeah, please.
I think one thing I've seen working over the last year or so is, one, educating medical personnel around substance use treatment. And there's a lot of stigma within that field itself. And that's where people often come first, is to an emergency department, or you know, in some fashion, intervening with the medical community, but really educating people who are not trained in substance use treatment about substance use and what it really is. And it's the physiological and all these things that Meredith has been talking about. I think that that's a really key piece. I think the other piece is things like this. And I think people telling their story and speaking up and normalizing the fact that this is everywhere. We are all a family or someone, you know, who could be impacted by this. But just speaking it, you know, one of the problems I had for years with the Alcoholics Anonymous piece was that anonymous piece, because we're shameful if we're part of, you know, if we have an addiction, we need to be ashamed, and we're going to be anonymous. We don't want anybody to know. We're going to hide. We're going to go talk. And I know that that's still the case and the need for many people. And I'm not saying that that should go away. That is one of the paths in recovery. But being able to speak that and talk that and share that story, I think is just, it's key to being able to get rid of the stigma.
Well, and I'm wondering, Nick, if you have some thoughts. You know, there's a question here around supports for parents. And I feel like in general, as somebody who's a parent myself, but also watching, you know, in the documentary, you know, Jacinta, I mean, it's hard being a parent no matter what. And being a parent, then also being incarcerated, and being a parent, or having a substance use disorder, and being a parent, just really hard to parent, and just parent and to do good prevention as a parent. And so I'm wondering, you know, what supports are kind of available for parents, or where is there some work that's being done in terms of, you know, supporting parents in their prevention efforts, perhaps?
Yeah, thanks. You know, I think the most important thing that we can do as preventionists for parents is education. It's just giving out information to them about, you know, how to prevent their child from using, or how to, you know, it's much easier to stop using if you never started. And that's a message that I think people understand in the back of their mind, but they don't necessarily understand how to do that in practice. So yeah, I think just giving information out to parents is a key component. Part of what I want to say earlier too, and I forgot to mention it, is something that I would like to see more of is more education in schools as well, around substance use disorders. You know, I'm 43 years old, so I came through the DARE program, as a lot of people did. And as we now know, that was not the best thing in the world. for educating people about the dangers of substance use. It just taught them what all the substances were, essentially. So more comprehensive curriculum in health classes is an important step, things that we're working toward as a state. The Prime for Life curriculum has been in Maine for a long time. It's often used as a diversion technique for young people that have been caught early on with a substance, maybe even just vaping or cigarettes or something like that too. So education for youth and education for parents is a huge factor in primary prevention.
Great. Yeah, Meredith.
As to combating stigma, I mean, I don't want to word vomit on you. I'm thinking about also, we don't normalize, asking for help in recovery. Like we say, don't do this, stay away from this, never get engaged in it. In my community, they were trying to have recovery residents, and the chief of police in Kennebunk, who's awesome, had me come in and sort of testify at the town hall, and they were doing that thing where they pretend that they're not just trying to NIMBY it, and instead they're really concerned about fire code, or they're concerned about available parking, and they're like, so they don't have to actually admit that they're being, although the work you do is so important, they're doing that whole crap. And they were really upset it was going to be near a middle school. And the thing they weren't getting is, that's awesome, because that means people in the middle school might say, here's some adults who have made a path in their life that they're not using, and that they're living a certain way. I'm like, this is terrific. They should come talk to the school. That a sober person can mean a whole lot of kinds of people, and it can mean RuPaul sober, the governor of Texas, but that's a big part of managing the stigma is normalizing recovery, and as what is it? It's the art community in Portland, Recovery Art. It's an acronym, but recover loudly so people don't die quietly,
Yeah. Yeah, I think they're
and I think in healthcare, being a little bit abusive to people who use drugs is very much normalized, and kindness is not normalized. It's you're not going to get one over on me, or I know why they're really here. And I've had so many meetings with hospital people, but yeah, I agree with you, Mallory. Healthcare is as the corporate speak would have it, a great opportunity for education on stigma and on managing. We had somebody outside a recovery center. The tow truck guy was routinely coming and towing our cars once we were in this one building. And the tow truck driver said to one of our clients, as he was just towing the cars, like, you'd move your car, junkie. And okay, that guy was a jerk, and we all can accept that. But there's a reason the guy who tows cars felt empowered to talk to people with substance use disorder that way. Because I bet you he wouldn't have done that outside an oncology center or a dialysis center. So he has had a whole lot of societal permission to stigmatize a particular group of people, that he would not feel that the whole world had his back had he been talking to another group of people.
Well, there's a question here about for Jacinta and Jessica, and I think it has to, the documentary itself has done such an amazing job of really of bringing to light so many of these issues, and I think that's part of reducing stigma, is sharing stories and showing those stories. And somebody said, I'd love to ask, it's Rebecca White. She wrote, I would like to ask Jacinta how you decided to allow the filmmaker to follow you, and if there were participants who changed their minds about appearing in the film. And I'm just curious about like how you all sort of came to your, sort of agreement. And there's another question about, like, for Jessica, how you knew when to end the film, because obviously, as this person stated in the question, Jacinta's story is not over. There's plenty more to go. So I'm curious if you all wouldn't share a little bit about your, just doing the film itself.
You can answer why you let me.
Oh, I didn't know in the beginning that it was going to be a film. And I also thought it was going to be on recovery, that I got this, I'm going to get out and be sober. And so I don't really think that I consciously made the choice, like, I'm going to make a long film about addiction in my family, like, or I'm going to let Jessica do it. It just kind of like our bond just grew and the film just grew. And as time went on, it just came to life. But, and as far as participants that were in it, majority of the people that were in it were gung-ho to be in it to begin with, to participate in something for like a greater cause, something that was going to show us in our light. That people were just very willing, and I'm grateful for them. But if Jessica asked me today to continue filming, I would absolutely say no.
I'm right here. Wow. Okay. But just to jump on what Jacinta was saying, like, because there were so many unknowns, and we met, and it was just basically we got along. There was like, I didn't know what this film was going to be until we got to the point where it was like, okay, let's keep filming. But yeah, first it was a photo essay, and then it was a short film, and then it became this, like, I thought she was going to say, like, I had so much fun hanging out with you. Can we keep going? I mean, she's with me in DC. No, I just started. But I think what was the second part of that question? That was, how did you know when to end it? Yeah. I think it felt like a really natural ending, because the film's, and we were, I don't know if Jacinta agrees.
It felt more awkward to continue filming after I was released than it ever did during my addiction or my incarceration. I had just naturally reached a point where, like, it was okay. Like, I've given the hope I need. And I was at that point, like, I was in early recovery, wasn't stable. And just needing my own space. And it just kind of, I feel that it fell in line with timelines and budget and everything else that we were going by. It was definitely like a God's gift to, like, get that part, get it done at that point.
And also too, it's like, it's really a huge part of this film is mothers and daughters. And, in some ways I feel like it's a love story between Jacinta and Kaylin. And so ending it on Jacinta and Kaylin felt, that's how we should end it, like, and also ending it in a way that we're not wrapping it up with a bow. Like, we're not saying that this is the end, because it's not the end, and where does Jacinta take it in her own life? Like, I mean, after this film, but I think ending it on Jacinta and Kaylin felt perfect to me. Like, it just felt like when they had the reunion in the parking lot, it was like that. I was just like, that's the end. Like, it just felt so, beautiful. I guess.
And Kaylin's bougie. She didn't want to be filmed eating. She didn't want to be filmed crying. She didn't want to be filmed playing slime. Yeah. She grew out of it.
Totally.
Yeah.
Well, I'm wondering, we're sort of like nearing our time, and I'm wondering if folks would be willing to share. Just, I feel like that ending felt very natural to me as, like, the viewer too. It felt like it ended on such, like, a beautiful moment of, like, hope and of love. And so I'm wondering if folks wouldn't mind sharing some of the things they are kind of hopeful for and hoping for as we move forward with in what do you see as, like, sort of hopeful outlooks, and perhaps that's a policy, or it's something you've noticed change in Maine, or a new program you see coming up, like, just a hope that you have, or a hope that you see.
I'd love to take a stab at that. Just in the policy realm, in the legislative and policy realm, I've been doing advocacy on and off for years, and I've really seen a shift in understanding. I think more and more people of understanding addiction, substance use, mental health, the interplay of mental health and substance use, the interplay of trauma. It's, over this last few years, the Criminal Justice Committee in Criminal Justice and Public Safety in the legislature is meeting with the Health and Human Services Committee. They never talked. They're both talking about the same things. They're both talking about the same issues, mental health, substance use, so much of the time. And they weren't talking to each other and seeing how the policy work that they each did should be interplaying with each other. So that to me is a very hopeful sign that we have seen a number of pieces of legislation that have come through that look to do harm reduction. There's an expansion of the Good Samaritan bill in the legislature this coming session. I'd love people to take a look at that. You can get information from any recovery group in the state of Maine would be able to tell you about it, I'm sure. But find out about and support that. Support increased funding for services. But there is movement. There is shifting in attitude, and I think this is a time. COVID taught us a lot, I think, and it exacerbated a lot of problems that were out here already. And so they've come to the surface and their eyes just like, whoo, hello, look at me. And I think people are responding to that. So step up, get involved, get engaged. We're at a tipping point, I really do believe. And we'd love to have folks helping push those messages to the legislature, to our policymakers, to administration, to our communities, our community leaders. But that gives me hope.
Great. Anybody else want to answer that?
I can answer it too. I think I'm really hopeful at the field in general, whether it's substance prevention or treatment or harm reduction or corrections or mental health treatment. I think that cohort of individuals in the state of Maine has a really good understanding about what trauma is and how ACEs affect young people and how they, how risk and protective factors play with substance use prevention and with substance misuse. And I think that reframing has been pretty sudden over the last, 10 years or so in Maine. It feels pretty recent change that people are starting to understand that and using that information to inform the way that they do whatever it is that they do. If we just keep continuing along that path, I think we're going to make a lot more strides, and we're going to be able to predict, who's at high risk and who needs more interventions, that sort of thing.
Yeah, Meredith, we have a
I
minute.
am most hopeful about the medical students, about the future doctors. I see a lot of them. They've been really amazing people. A lot of them are very socially active before even going to medical school. And even within the past 5 years, students come in and they're already volunteering, doing harm reduction. They're already doing a needle exchange. They already don't need for me to tell them, actually, we prefer a substance use disorder or a person who uses drugs to add, like, they're already there. And I've already had students who then go out and when they're working in the emergency department, when they're working in the hospital, will actually get in there a little bit and do battle as a buffer between the stigmatizing physician, the stigmatizing nurse, and actually try to be the face of kindness and the face of generosity when people are coming in struggling. So I feel like we're sort of infiltrating the healthcare world a little bit.
Yeah,
and I'm very hopeful about that.
That's wonderful. And I know we just have a minute, but I wanted to give Jessica and Jacinta, if you had any hopes that things that you see shifting before we end.
I hope that eventually addiction is not something to be ashamed of or to hide, and that it's not something that people look down on us for, and that the shackles of addiction are the only shackles that we have to wear. That, our addiction isn't going to put cuffs on us and, charges, and people don't wake up and say, I'm going to get high so I can rob this house. So I'm going to rob that house so I can get high. If they just see how things go, and the more of us that, come to light and tell our story, speak the truth, and don't ever forget to go back for the next one. We're going to get through this. I believe we're going to get through it.
Yeah. Wonderful.
Jessica?
What she said,
Perfect.
Yeah, that's lovely. Wonderful.
This is why we don't hang out. This is
Yeah.
why we don't hang out. She steals my thunder. No, just kidding.
I just know.
Oh, it's perfect. It's a wonderful ending. Thank you so much. And thank you all so much for participating. This was really great. And Heather, I'll hand it over to you for our closing.
Yes, thank you. And just I'll take a few more seconds of people's time, but thank you, Liz, and to our panel for tonight's discussion. It's been really both informative and inspiring. And thank you again to our co-sponsors and especially to Jacinta and Jessica and their team and all of you watching the documentary and participating in tonight's discussion. Again, we'll post this discussion on our website at mainepublichealth.org, and we'll send it out to registrants via email. But thank you all again for coming and have a great night.
Thank you.